had to begin to lock down again. Well, I am happy to see that our speaker has arrived, Vicente Navarro. Let me introduce him to our audience and
excuse me,
tell you-
but finally have been able to join you.
yes, as I had mentioned, Vicente Navarro is professor in the School of Public Health at Johns Hopkins University. And Johns Hopkins is one of those universities where faculty still seem to play a role in governance of the institution. It's not totally controlled by administrators. Maybe he can correct me on that. But he was in a very important meeting, and that's the reason he was delayed. For 4 decades, Vicente has been a prolific critic of healthcare under capitalism. He's authored 24 books, among them such exciting titles as Dangers to Your Health, Neoliberalism, Globalization, and Inequalities, and most recently, Why the United States Does Not Have a National Health Program. The long-standing failings of the system he has been pointing to have now been brought into full view by the pandemic. So let me turn the floor over to Vicente so that he can speak to us, and then that will be followed by questions and comments from our viewers. Welcome, Vicente. Glad you were able to make it.
Thank you so much.
You're a little bit out of breath, I'm sure.
I will be relying very heavily on data, and that I assume that you are seeing the slides. Are you?
Yeah.
It's important because I will be.
Yes, you can share screen.
Let's see. How many people are more or less on track? How many
we
people?
have no way of knowing.
Yeah. Okay. Then for those of you who might be interested in what I'm going to say, and I'll be presenting quite a number of slides, please do let me know, and I'll be glad to send it to you. If you send me your note and your address, email address, so I could send it to you. But I thought that that was important that I could explain about the enormous crisis that we are witnessing in the United States. That was the primary reason why I was held up at Hopkins. Hopkins is now in the middle of the hurricane, in terms of getting information about the pandemic all over the world. And the situation is even worse than what it is projected. And that held me up in that conference, which I was asked to participate. Anyway, so do you see, can I ask you, do you see the slides?
Yes.
Okay.
Yes.
Okay. So what I thought that when my good friend Cliff asked me to speak with you, I thought of speaking about the crisis we were seeing in the United States in the health sector, which is the enormous crisis of the economic political system of the United States. Okay. And then maybe we have time to make a summary about what can be done. But believe me, I have been in the United States for half a century. I came from Europe, escaping from fascism in Spain. And I had never seen the United States in such a difficult shape. So I think that we have a major crisis that no question is going to have a major political crisis as well. No question about that. So it's in that sense that I wanted to speak with people. I don't know how acquainted you might be. Cliff mentioned that you might be from all over Latin America and United States. But even you are from the United States, you might not know the data I'm going to present to you, because it's not easy to get information about what in the hell is going on in the United States. So let me now then to go to the slides. What is let me then explain the medical care of the United States, which is quite unique. It's quite unique. And in order to understand the medical care of the United States, or any country for that matter, we have to know power, how power is distributed in that society, how power is distributed in the United States. And I want to speak about class power, which is a category of power that is rarely faced in the United States. It's very interesting because power is unequally distributed. And it's agreed that men have more power than women, and now it's increasingly agreed that whites have more power than blacks. And that is a very important subject that needs to be stressed. But not many people speak about class. And what I'll try to present today is that without understanding class power, you do not understand why we have the high mortality pandemic that we have in the United States. And I know that sounds almost a provocative statement, but that is, I'm a speaker as a scientist, and that is why I present data. If someone disagrees, come up with another data, and it's unlikely you'll find it. So class power. But let's see, what is the characteristic of the medical care of the United States? We have a lot of people who don't have any coverage whatsoever. I will speak about that. A lot of people who have very poor coverage. It's a very inefficient system. It's profit-oriented. It's profoundly unfair. It's very, very expensive and very, very unpopular. So the question can be raised in what is considered to be a democracy. Why does it change? Well, that is because our system is not as democratic as it claims to be. That is the issue that I want to address in half an hour or whatever. Okay. Let me come up here first, and let me deal with class. I have lived in many countries in my life. I live in Spain, where I came from. I have lived in Great Britain. I have been in Sweden, and I think I know Europe quite well. And frankly, I don't think there's much of a difference in terms of class structure between Europe and the United States. They're very similar. On the top is those whose power came from the property of the major sectors, industrial and services sectors, financial sectors, and is what is called in the United States corporate class. In Europe, you'll call it the bourgeoisie. We don't use that term, sounds too French. So we call it the corporate class. Used to be called the capitalist class. But exist, I want to repeat that exists. And actually, many people are aware in the United States, even at the still level, who does power in this country? Corporate class is a sentence that appears frequently. Then you have, by the way, the dark part is the percentage of women. And this, according to the census, the last census we have, 2010, is going to change now in 2020, but it's not likely to change much. So then they have with the upper middle class are the professionals. By the way, the corporate class, now this doesn't work very well today. Anyway, so this is the corporate class, corporate owners and managers, the upper middle class, professionals and technicians, we are, and the business middle class executives, who are the owners and managers of the small enterprises. Then the lower middle class, a group that is reducing, the self-employed, shopkeepers, craftsmen, and then the working class. You have the clerical, the majority women, manual, the majority men, services workers, the majority women, and then the farm workers. This is the class structure of the United States, which is not terribly different of Germany or France. There are differences in Europe, the industrial sector is larger, but there's no big difference. The big difference when you land in the United States, there are no classes in the United States, upper, middle, and lower. And moreover, when you ask people, they say what class you belong to. If it's asked upper, middle, and lower, the majority of people tells you middle. It's understandable. There you see Navarro wrong. People say they are middle. But if you ask differently, are you upper, middle, or working class? You'll be surprised. There are more people who find themselves working class than middle class. We have evidence of that. Look at, for example, in terms of this, there has been a more complete information done at the beginning of this century, the General Social Survey. Here you say by family income, and the median income is 42,000. You'll see how people define themselves upper, middle, working, or lower. Lower means basically unskilled working class. And you'll see how the overwhelming majority of the working class defines themselves working class. So that is, and you might be surprised, but the same happened in Germany, France, Spain. If you ask people, are you upper middle or working class? You ask the question that way, the majority of people who respond is working class. How interesting. And what is also very interesting is that when you look in terms of how people live, the politics of the people, how they perceive the government, what they think the government should do, and so on and so on, there are enormous difference by class. For example, as you expect, those who think that the difference in income are too large, as you expect, the unskilled working class and working class agrees much more with that than not the upper class with the corporate class. The government should distribute incomes much more favorable at the bottom than not on the top, and so on. So you'd expect that in that respect is from the culture to the attitudes to the type of music that people listen to the anything, how people vote, class plays a very important role. The majority working class, by the way, abstains in the United States, and the one who voted used to vote for the Democratic Party. That is changing. I'll come to that in a second. So it's in that sense that anyway, and we have a situation in which the enormous class dominance of the institutions. If you look, for example, in the class composition of the US labor force, which is the first column, this is the column that I showed you at the beginning based on the census figures. The first slide was vertical, now horizontal. You'll see how who sits in the cabinet of the last 5 governments of the United States. And you see corporate class, the well majority, slightly more in the Republicans than in Democrats, but that don't make difference. Corporate class in the cabinet, Senate, corporate class, House representative, corporate class, and upper middle class in the Senate and in the House. And working class does not appear in the Senate, and only in the Congress appears in a very, very small percentage. Someone like our Senator Barbara Markowski, she was a social worker, then became a member of Congress and then member of Senate. But Barbara was quite an exception within the origin of most of the politicians in the United States. That is the nature of. If you are Afro-American or Latino, you'll ask, and you should ask, how many are African Americans, blacks, or Latinos? Or if you are women, how many women? But very rarely is asked how many of them in power came from working class families. That is a question that should be asked in the United States, should be asked. And that is, in that sense, why is such an important issue. And that class dominance appears also in the whole medical institutions as well. Okay, so I would like to correct my friend about the control of Hopkins. The ones who dominate Hopkins, the board of trustees. And if you know the board of trustees of Hopkins, that is a power structure of the state of Maryland. Okay, so in that sense, the president appoints the board appoints the president appoints the dean appoints the chairman of the department, the chairman of the department appoints the professors. So that hierarchy is very clear. And that happened in majority of universities in the United States. There's a very little ideological diversity in the United States that has to be recognized. You don't see communists, socialists on the one side and most fascists on the other. You do see fascists on the extreme right, but you don't see many people on the left, you see. And if you are in the London School of Economics or in the Barcelona, any of the universities, you see faculty members who belong to all political colorations, including Marxists. Very few. Hopkins, only 5 or 6. So that is United States academia, extremely limited in terms of ideological diversity. Now, let's move on in terms of that. And that something has gone wrong. Sorry about that. Let me then move on in terms of, with that, let's go over that appears also in terms of mortality. You can define the class that people belong to by the class. Of course, also by the race. The race is the variable that makes esteem the class differential. So when you say the working class, be assured that within the working class, the African Americans, the Latinos are worse. So in that respect, but that cross component of racism is still important. And that is an issue I'll be addressing myself later on. Now, is in that sense that you can define the class by looking the death certificates, how many years that individual has lived. And that has now appeared quite clearly in the pandemic. What the pandemic has done is to show the reality of the United States without any type of softness. The cruel reality appears now quite clear in the pandemic. Okay, so it's in that sense that you can see here that this life expectancy, in terms of the above median earnings, you can see how life expectancy has been increasing much less in the below. But now, even at this level, that has changed, because in some sectors, like in the working class, the life expectancy has been reduced quite significantly. That I will be speaking about this later on. So here's where, in that respect, now let's go to the medical care. It's certainly not a question of resources. United States spends more in medical care than any other country, including public. Look at this slide. This is the public spending per capita for health exceeds the total. Okay, so here you have UK. UK spends $4,070 per capita in the National Health Service. Japan, $4,770. Switzerland, $7,320. United States, public expenditures, $7,273 per capita. 7,000. Okay. No other country spends more per capita in medical care as in the United States. How remarkable. And also private. So when you add public and private, look, we spend $11,120. Meanwhile, people die because they don't have medical care. That is a reality. That's a brutal reality. Okay. And here, of course, I include the money that is not paid on taxes for those who have private insurance. Okay, when you have private insurance, you get the fiscal benefit and you don't pay taxes. Okay, so that is important. We understand. It's not a question of money. Okay, it's not a question of money. We have plenty of money to do it. It's the nature of that channel for which that money is spent. That is the critical issue. That is the critical issue. And here you can see here that is uninsured. The amount of people who are uninsured went down. Medicare, Medicaid, you can see they went down dramatically, but then came up again. Then Obamacare came up, but Obamacare has not made the problem disappear. It's not universal, doesn't cover everyone. And we still have quite a number of people, up to 40 million people, do not have any form of insurance coverage. President Obama, when he was a candidate, he was in favor of Medicare for all. He disappeared that commitment when he was president. Anyway, so let's now look very quickly in terms of these slides. Not only people who don't have coverage, but also people who have coverage, the uninsured, underinsured, which is very important. Many people think they have coverage and it's very limited. You see, has been growing as well. And let me put here, of all the slides, I have seen a lot of slides in my life, and this is the most dramatic one. This slide shows that 40% of people who are dying are worrying because they don't know how their families are going to pay for the medical bills. Can you imagine a more cruel situation? You are dying and worrying how my wife or how my child is going to pay for that. It's an extreme form of cruelty. Okay, that is United States medical care system. You see, you have to comprehend that. So it's in that sense that you can see then here Life expectancy is very poor compared with other developed capitalist countries. Infant mortality is very high. Now, this is, in that sense, the cause do not result from, the classical argument is, well, because United States citizens have very bad habits, they do not eat well enough, they eat too much fats and so on, or you see we are very old, or we actually overuse healthcare. That is not true. That is not true. Look these slides. The smoking prevalence, as a matter of fact, United States, the number of smokers is percentage-wise lower than other developed countries. Elderly, no, we are a young country. They use hospitals too much. It's not true. Inpatient days is less per capita than not in our countries. Or physicians visit, they go to the doctor too much in the country. They go less than other countries. Number of nurses is too high. Not really, it's too low. Well, we use a lot of scanners, a lot of technology. It's not true. Look, and compared to other countries, our countries use more. But they have the benefit of having all type of benefits, things like renal failure, transplant, and so on. Not true. But we provide long-term care. Not true. So why, damn it, is so bad? Why is so bad? And then you have to map, you see, it's a very, very inefficient system, okay? This is, in spite of being so expensive, but still when you go to see a doctor, you pay copayment, which is quite high. Now, we start coming up where this money goes to. Profits is a critical element, but the insurance overhead, what goes to administration, is very high. Private insurance has a high overhead everywhere. To give you an idea, medical care is the federal government, and the overhead is quite low as a public program. But if you go to the private insurance, the overhead is huge. But here, what is more important is the for-profit system. The CEOs, the chief executives of the major insurance companies, look at the salaries they get. This is information for 2018, okay? That is quite a lot of money, okay? Then you goes $117 billion. Hell, that is the heads of those insurance companies. Then profits for the different sectors, pharmaceuticals, insurance, equipment, providers, distribution. Look the amount of profit that appears. And look at the drug companies. The drug companies, the most profitable industries in the country by far, okay? So in that sense, that is where all that could be resolved easily. How? Well, let's look Canada. Canada used to be a system of funding and managing healthcare very similar to what we have in the United States, very similar. But in Saskatchewan, they were governed by a socialist party, and they decided rather than having to go through the insurance companies, why don't we get rid of the insurance companies so the employees, rather than paying to an insurance company, let's set up a public system on which then these funds collected from the employers and employees, we contract the providers, okay? The providers continue in the private sector, but the one who defines the price is single payer, is the agency that is a combination of the provincial and the federal state. And look at what happened in Canada in terms of that. Sorry that this. Sorry that. Look at in United States, the insurance, the majority of insurance, health, medical care insurance, go through the place of employment. Not all, but the grand part. And therefore, if you are employed by Hopkins, for example, you pay a premium. And that premium is a standard premium. does not depend on the level of income you have. So I pay the same premium than my secretary. My secretary's salary is lower than I am. It's profoundly unfair. You see, you can see here, the poorer the person, higher the percentage of income that goes to get insurance. The premiums are not related to the amount of money you make. I hope that is clear. Now, it's in that sense, in that scenario, that you can see here that what happened in Canada is paid with taxes. And taxes, income taxes are progressive in terms of that. So that is one thing. They put it that way. And what happened? Healthcare costs as a percentage of GDP, look in the United States, have continued red, while in Canada has going up much lower. Okay. And important, infant mortality, which was high in Canada, went down more rapidly than not in the United States. And the administrative costs have gone down quite dramatically. Okay. Now, that is what is called now Medicare for All. Is the program, the proposal of Bernie Sanders, but it was initiated by basically Jesse Jackson. And that I know that because I was part of that. And that is very, very important that I underline that. Why? Because let me finish that, then I want to come back to that. Because why people tolerate that? Because the democracy in the United States is dramatically limited. You have to realize that. I think that, and in what way democracy is being violated? A, is not proportional. Okay. Remember that Hillary got 3 million more votes than Trump, and Trump won. And the one who finally decides is not the population, is the electoral college. And the electoral college is skewed in a way that some states have a lot of power. Okay. I say that because now it's all among progressive, all so excitement because all the polls show that Trump is not going to win. I'm not so sure. I'm not so sure. Because in that respect, the polls do not give much information. It gives about the mood of the country, but that is not what counts. It's the loyalty of the votes. And Trump has an enormously loyal base. 92% of Trump voters will continue voting for Trump. And the issue is whether the Democrats will be able to raise a similar type of loyalty from the overall population. They will be very loyal from the African Americans and from Latinos. But the critical, what about the working class? That is a critical element, you see. That is an extremely important thing that we have to describe. Let me see that in terms of why I emphasize that Jesse Jackson was the one who started the movement for medical care for all. In 1984, he ran as the voice of the minorities. He called me and wanted me to help, and I have a very close friend called Quentin Young, who was his physician, Jesse Jackson too. And that Quentin was a very close friend and said, yeah, Vincent, you had to do it. And I did it. And I became Jesse's advisor in 1984 in the primaries of the Democratic Party. And he ran as the voice of the minorities. And I told him that he was wrong. If he wanted to be president, he could not run as the voice of the Afro-Americans or the minorities. Okay. He ran. And the New York Times wrote a beautiful editorial. Not even his mother had written such a nice editorial. And well, I said, you have a problem. In 1984, ran as the voice of the minorities. In 1988, however, changed. The rainbow was established because when you add black, white, yellow, green, or whatever, that becomes the majority of Americans. Okay. And he ran as the voice of the working class. Now, he didn't use the working class. That is a forbidden term in the United States. Or the working families, that is what, okay. So he ran as the voice of the working families. And he ran a program that was universal, not dedicated to the minorities. Universal, a national health program. And I know because I wrote that. In the Democratic Party, I wrote that, the National Health Program, you see. And he almost won in the primaries in Atlanta. Okay, he almost won. As a matter of fact, he won, but he lost because the Democratic Party apparatus can nominate a whole set of people by that, and then they become the majority. Okay, And he even got those who, well, in that respect, Cliff will know the meaning of that. But the working class, white working class districts, neighborhoods of Barcelona, of which the most important one is Dundalk, steel workers, 20% of them voted for Jesse. Remarkable. Okay, remarkable. White working class, blue collars. Okay, so that is why I think it's terribly important to be understood that in the United States, the strength of those who command the whole society, including the medical care sector, have so much power because the progressive forces are too divided. Okay, this is the critical issue. I think you have a strong social movements, we have a strong feminist movement, but women have very little power in the United States. Look how many people are in the Senate who are women. And maternity leave is a ridiculous 2 weeks. In the majority of Europe is 8 months. Women have very little power, but they are very strong feminist movement. The same in terms of the minorities. We don't have a large that, but minorities continue to be exploited brutally. We have a strong elderly association, but retirement in this country is a joke. I speak in those terms, has understood why. I speak with my feminist students. You had to ask why you have such a large NOW now, millions of women, and why women had too little power. And I could ask the same, and that is why the Rainbow Coalition started with Jesse. And I was telling Jesse, if you add all the colors in this country, we are the majority. But if each color goes on, tries on their own, we'll never beat them. And that is the triumph of those who are in power, you see. And these are the, so, and what is the difference? Let me go here, and I want to go to the last slide, because I would like you to know, this is another article I just written. I don't know, can you see it? Cliff, I can see your face. Can you tell me whether you can read this slide? Can you read it? Okay, you do not have the microphone. Raise your hand if you can read it. Okay, great, okay. Well, here you have the countries in both sides of the North Atlantic, okay? And here you have the strength of what we might call the left. You have the social democratic tradition, is the socialist tradition in democratic sense. You have the countries that have been governed for a longer period of time by a left-wing party rooted in the labor movement, okay? Sweden, for example, okay? Norway, Denmark, Finland, okay? These are countries that from 45 until now, the majority of the period has been governed by an alliance of the socialist, social democratic parties with communist parties, with green parties, with, so that is the majority of the time. Okay, that you mean labor is strong. Then you have the conservative, the Christian democratic parties. They have been governed like Germany, but where the social democrats have also governed in alliance with them. Then you have the Southern European countries, Italy, Greek, Spain, Portugal, who were governed by dictatorship, fascist dictatorship. But since democracy came in the late 70s, they have been governed by the left or whatever. And then United States, the liberal tradition. Now here, let me stress, the liberal in the international language means very right-wing. Liberal is someone like Reagan, okay? That creates enormous confusion, okay? So in the United States, we call liberal someone like Jesse Jackson, or maybe the Senator Kennedy, who are in favor of distribution of resources, of providing universal programs. That is what we call liberal. That is very misleading. Internationally, liberal means Reagan, okay? And that creates a lot of confusion in terms of. So in that sense, and the majority of countries in Northern Europe have been governed by socialists. When now Trump is interesting because the degree of ignorance is so large. You know, so he said, "Oh, we accept the immigrants from Norway, but not from Africa." That typical racism. But listen, Tom, do you know that these from the region have lived in a socialist government? So they are in terms of a Cuba and so on. They have anything that they dislike, they call it whatever they might be calling. But listen, if people in the United States will know that we could have services like the majority European countries have, I'm sure they'll be excited about socialism. So in that sense, that is where, but where, here we go, class exploitation. If you look at different indicators of inequalities, and that is a very academic paper, like Gine, others, you see there is quite a gradient, where Sweden, for example, is the less unequal society in the world, and United States, one of the largest inequalities. Okay, class plays a critical role. But if you look in terms of women, you see interesting that in the, look at, for example, here, in terms of gender inequalities, that those countries that have had a strong labor movements and have chosen the democratic route, have less, not only class, but also gender inequalities. Okay, if you look at the Swedish parliament, more than 50% are women. Okay, and women have a power. Okay, why? Because the feminist movement in Sweden was part of a labor movement, and the labor movement was very powerful, have an enormous sensibility towards the women question. Okay, so what is missing in the United States is the linkage between the different forms of exploitation. When each one flies on their own and competes in terms of public attention, you have lost. That is 1984 with the Jesse Jackson campaign. If you run as anti-88, as the voice of the majority, adding up the class issue, the race issue, the gender issue, then you can defeat the controls of power in the United States, you see. That has relevance in terms of the current elections. I think my greatest concern is that it's not enough to defeat Trump. It has to be presented an alternative, okay? And Sanders represented that alternative, okay? But let's look at in terms of what is now Biden. Biden finally accepts that something needs to be done. But what solution he comes up? Okay, no medical care for all, but rather than starting Medicare at 65, we'll start at 60. Actually, even worse than Hillary Clinton. Hillary at least went down to 50. But do you understand that in the middle of the huge problem we have, a pandemic, that is what Biden comes about with? Think about it. I told you why we have the highest mortality in the world, or one of the highest mortality in the pandemic. It's very difficult. If you understand, it's very easy to understand. If you see this data, it's so easy to see why. The healthcare of this country is aimed at profit, not at saving the population. And it's not a question of have money. No, it's a question of controlling it. This is so obvious that even Governor Cuomo realized that. Governor Cuomo, in the middle of the hurricane, started becoming more and more left-winger. Finally, the reality hit in his face. And he said, we should have public health care in this country. Of course we should. It's so obvious, okay? So in that respect, the need for these profound changes is obvious. And I'm not sure that the current leadership of the Democratic Party is committed to that. I hope they are. And I encourage everyone, because Trump could not be worse. Let me add, I live under many years in my youth under fascism in Spain. I fought, and that is the reason why I had to leave Spain. I was active in the fascist underground, and the Gestapo was following me, and I had to escape and go into Sweden, Great Britain, finally to the United States. So, and the only benefit I have of having lived under fascism is that I recognize a fascist when I see one. And I tell you, there are a lot of fascists governing United States today. They do not wear black uniforms and raise your hands, but in the way how they think is remarkably similar to the fascists I fought in my youth. Okay, and that is why, in that sense, that is where we stand in terms of that. Well, Cliff, I have gone over. I have left some space so that some people might like to jump in and say whatever they want to. Okay.
Okay, well, thank you very much, Vicente. If you'll take down that screen, I have another screen to put up.
Okay.
We have, okay. We wish to open the floor for people who have questions, and you get your question to us by emailing global.justice.cliff@gmail.com. Send your questions or comments to that, and I will pass them on to Vicente. To start the discussion off, however, we have here Kathy Canepa, who is a retired physician in San Miguel. And while we wait for the emailed questions, perhaps Kathy will have some points she would like to raise with Vicente.
Okay. Hello, thank you for that presentation. It was very powerful. I have a two-part question. Do you think a publicly funded and administered public option could survive competition with for-profit health insurance companies in the United States? Can you envision a way that they could survive the private companies cherry picking the healthiest populations and leaving the public option to care for the neediest and sickest, requiring the most care? And I guess part two, and you can answer whichever, if a public option could survive, do you think it could approach universality? I mean, some people think that this would be the route to Medicare for all, to have a public option and have people see that it's more affordable and gives better care. Do you think that's true, that a public option might be a route to Medicare for all in the US? Or if not, do you have a suggestion of how we might get there?
Well, it's a very good question, but I think that is a difficult answer because intellectually it will always make sense that let's offer them a public option and see whether in that sense they could show the exemplary and how good it is, and maybe the others will take it. But let me add here something that happened that taught me to be skeptical about that. I spent, because I have been advising Reverend Jackson, then when Hillary Clinton set up the task force in the White House to see what could be done, they asked me, they asked the Rainbow to send someone, and Jesse Jackson said, Vincent, you had to go and spend time in the White House. And said, Jesus Christ, the last one. But anyway, I spent 1 year in the White House seeing how power operates. And by the way, it was an extremely interesting experience and quite frightening, quite frightening. I saw how power operates. And that you'll be surprised how ignorant the power structure is about what the hell is going on at the street level in the United States. But anyway, so I was there, and I never quite understood why I was in the White House. I didn't know why I was the token radical or the token Latino or the token. I know I was the token, but I was curious about what I'm talking of because no one was listening to me at all. And suddenly a group of, I think, Citizen Action and others set up, and they collected more than 500,000 signatures in favor of medical care. And hell, President Clinton called me right away in the Oval Office, Navarro, do something about medical care, about single payer. And I say, Mr. President, can I write whatever? Yeah, I do. It was 10 minutes something. And I put in the draft of the legislation, and those states who like to develop single payer, they'll be entitled to do it. Okay? With the idea that if they have a single payer, then everyone else will be delighted and join in. That is happening in Canada. It did not last 2 hours in that draft, okay? Because the power structure is extremely knowledgeable and know how dangerous it is. So to have a public option would be very much depending on what type of option we're speaking about, okay? Because if that option is because to taking care of the expensive and then they take care of the not so expensive, that will be the tendency of the system, you see, and that it ruins that. So it will depend very much how you design that form. Single payer has a very specific meaning, okay? A public option has a different meaning. You see what I mean? So it's in that sense that will depend very much how it is done. But I think what is terribly important is to try to convince people. The worst enemy the progressive have in our country is the sense of fatalism, is nothing we can do, okay? That is the worst thing, because that sense, well, it's not, well, listen, I have been in the United States enough years that anything has been achieved has been through an enormous mobilization and struggle. Anti-Vietnam War. When I arrived in this country, for me, Vietnam was called Indochina, and was a good cause. They deserved to be independent, okay? And here was a fight against communists. Good Lord, you see. And that the first demonstration we have in front of the White House, were only 200. Most likely Cliff was there as well, but David Harvey, a few others were there. It ended, was 2 million people. But that is where Vietnam ended, you see. Not only because of the victory of those who were fighting for liberation in Vietnam, but they themselves thanked those people in the United States went to the streets. So everything had required a lot of movement. But the critical thing is to diversify our commitment and be capable of allying with other forces, you see. The families have to understand that the women, the majority of women in the United States are working class women, okay, which are different from the upper middle class women, okay. And Afro-Americans have to understand the majority of Afro-Americans are working class Afro-American, okay. How the President Obama improved the standard of living of the working class, including the Black working class? Not much, you see. That is what has to be said. Identity politics are a term, you see. I think that it's not enough to have a woman, it's not enough to have Afro-American. That has to have in mind the majority of their own constituency, okay? So in that respect, unless there is a set of, well, there's no other word, unless there's a socialist project, forget about it, okay? And that in that respect, call it in wherever, as a matter of fact, we don't need to even look at Europe, United States. The New Deal was a very ambitious project. President Roosevelt, last speech, he spoke for the expansion of the social rights in the United States. He said it was a social democracy Swedish type already in 1945, you see. So even in the history of the United States, we have enough of that New Deal that needs to, and we need to have a Green New Deal, but a social New Deal, because I'm concerned with speaking so much about Green New Deal, which of course is good, but social New Deal, because people are suffering. The pandemic has shown the enormous. This morning, I was reading in the European press, the German Social Democrats, who are not radical at all, have come up and say, one of the solutions is to have a week of 4 days. The current situation, if you want to resolve the problem of employment, you have to reduce the number of days and go to 4 days a week. Oh, now Trump, they'll call, oh, this is Bolsheviks and so on. Listen, these are German, you see. That is why, in that respect, the mobilization is critical. I think it's terribly important that in that respect, sorry, I have them. It's terribly important that people organize. I think that we are seeing a very important monument about the Black Lives Matter. That is very positive development, but it's not enough, even for Afro-Americans. I'm sure the leadership is fully aware of. Okay, so the Push campaign was very important. Was not only a race issue, was a class issue, but there were some mistakes made in there as well. Okay, so in that respect, is critical. Okay, the city of Baltimore, unless Dundalk, white working class, and East Baltimore, black working class, work together, that city will always be governed by the right. And now is a black right, and before was white right. Okay, so in that respect, the power structure can change the color and do not change 1 inch for the average people in the street. Okay, now the whole city power structure in Baltimore is Afro-American. I don't think it has changed much for the working class districts. Okay, so unless Dundalk and East Baltimore get together in front of that power structure, I see very little is going to happen in those neighborhoods.
Okay, Kathy, do you have any more to follow up with? I'm showing you the audience, the screen with the email address to send your questions to global.justice.cliff@gmail.com. By the way, if you have any suggestions for future webinars that you would like the Center for Global Justice to produce, send your suggestions to this same email address.
Well, I thank you very much for that response, and I agree with you. I think, unfortunately, a religion in the United States has basically been anti-communism, and it's very easy to challenge so much of what would be socially useful. I remember that during Tea Party demonstrations, I saw signs that said, "Get your government hands off my Medicare." That, the government is so demonized. It's very hard to confuse, very easy to confuse people. But I have another question. In Spain, my understanding is that there is universal health care, which is publicly funded, but that there are alternatives. And initially, with the COVID pandemic, Spain was able to get it under control. But now the numbers seem to be climbing. What is Spain doing wrong, or what does one need in addition to a single payer healthcare to manage a pandemic?
Yeah, good question. And Cliff, I had to tell you, unfortunately, I arrived late and I had to leave now because I have another meeting in 5 minutes. So that might have to be the last question. But it's interesting because Biden made that observation the other day against Medicare for all. Said, well, look in Europe, they have Medicare for all and they have not done so well either. And, first, they had done better than the United States. That is even Spain. But second, in Spain, they have a national health service. And the problem is that with the policies of austerity, they have been governed by the right-wing parties. They cut the public expenditure quite significantly in a way that the healthcare sector suffered quite considerably.
Mm-hmm.
The best example of that is that the level of infection by coronavirus among health workers was very high because they didn't have even the material like masks and other things to protect themselves. So it was a very good system in terms of guaranteeing access to healthcare to everyone, but those who were up in the trenches pay a cost in terms of not having the equipment in order to protect themselves. Okay, so and that was why in that respect. And the other thing is that elections took place on which a left-wing coalition of the Socialist Party and a party to the left of the Socialist Party come up. They do not have the majority in the parliament, but at the same time, they govern at this point. And they had to, they didn't have enough power to impose certain measures of confinement. They wanted to, because the right wing at this point intends by all means that the left-wing government fails. Okay, and that is the situation. Okay, well, listen, was great to spend that time with you, Cliff. I'm sorry I came late. I'm sorry I had to leave, but my life is these days out of control.
Well, we certainly appreciate your finding this time in your busy schedule to share with us. And you've certainly given us a lot to think about, a lot to digest. If you send your PowerPoint to me, people will ask for copies, and I can forward it to them, because I'm
Sure.
sure that there's a lot of good information there that would be worth having.
Sure.
So thank you very much, Vicente.
Thank you
We
so
really appreciate
Thank
this.
you.
Bye-bye.
And as we end this session, I want to tell you about our next webinar next Monday on immigration, the status of asylum seekers at the U.S.-Mexico border and beyond, by immigration attorney Rebecca Eichler. Don't miss it, 1 o'clock next Monday. This, since the COVID, the Center for Global Justice has had to end all of its revenue generating programs. Nevertheless, we continue to pay our Mexican workers the regular salary. And so to make up for that, we urge you to make a donation. Please go to our website, globaljusticecenter.org, and donate as you can. It would be greatly appreciated. And we hope to see you again next Monday. Signing off with that. Ciao.